two worlds collide, Lyme disease and long COVID. Why are they so hard to treat, and what happens when they overlap? Today, we're going to pull back the curtain on one of the most complex medical frontiers. All of this coming up on The Long Haul with Summer. Welcome to this episode of The Long Haul with Summer, where we're talking about real stories, real solutions, innovative treatment plans, and challenging traditional medicine. Today, I'm so excited to have one of our team experts, Carrye Hodges, who is here to talk to us all about Lyme disease. So, Carrye, welcome to the studio.
Thank you. Thanks for having me.
Yes, you're welcome. I'm so excited to have you in here today to talk about all of the fun things that go along with Lyme. And why don't you start by telling us who you are, what your background is, and how you got into treating Lyme disease?
So I am a nurse practitioner. I started off working at Children's in the pediatric ICU, moved over to UAB in the ER, and then I moved to Washington, D.C. and worked for a clinic that specializes in Lyme disease with patients all over the world. So I worked there for several years and then moved back to the Southeast. There's not a lot of providers in the Southeast. And I myself have Lyme, and I had symptoms starting when I was a kid, and we just couldn't figure out what was wrong. And so I went to over 5 states for trying to find a diagnosis. And ultimately, I was diagnosed with Lyme disease, but it was so delayed because I was told Lyme disease is not in Alabama. And actually, in 2015, they declared that 7 states are endemic with Lyme disease. And so based off of my experience of being in Alabama and told there is no Lyme disease and not a lot of access to care, I wanted to come back down to the Southeast to increase access to care. I wanted to reduce the amount of people who had to have my experience, because if it would have gotten identified and treated earlier, it wouldn't have been so deep-seated with residual effects.
Wow, that's amazing. We've talked to a lot of people, or several people, who that has kind of started their path. They were patient themselves. I mean, you know, my story, that's kind of how I got here. And so it's interesting that sometimes that's how it starts. But I think that makes you more empathetic with the patients, and certainly more understanding. And it also helps me, I guess, educate them down the treatment path, you know, because you kind of know how things are going to go.
Yeah.
So I think that's amazing. Yeah. And so tell us a little bit about, I know we've talked about this a lot, but talk to us about Lyme and long COVID and how those started to cross over and what similarities you see in those diseases as you started treating down in the Southeast and dealing with long COVID.
So they are very complex patients, which you and I know, and these patients have been sick for quite a while before they come to us. So Lyme, Borrelia, it's a little corkscrew, a spirochete that can drill in any tissue in the body. So it has multisystemic effects. With it being such a complex bacteria, it creates a lot of inflammation. So it's a bacteria, but then we have COVID, which is a virus, and that virus, as you will know, is kind of like barbed wire through the inside of the blood vessel, so the endothelium. And so that creates a lot of inflammation. And then you've got Lyme, the bacteria that is pro-inflammatory. And then there's another co-infection, Bartonella, which is very specifically likes the blood vessels and the vasculature. So all three work together, and it's like gasoline on the fire, unfortunately, makes a bad situation worse. But all of them drum up inflammation, which modulates the immune system. So if you're walking a balance beam with Lyme, long COVID has the potential to destabilize you. And if you previously had Lyme, it may make you relapse. So that's one component. Also, with that heightened inflammation, you may be more likely to have an autoimmune type picture. So that is one aspect as well. And then also the inflammation hitting the nervous system. So we'll see some of the dysautonomia, the POTS, but with the poor perfusion or the blood getting to certain areas and the tissues, then it can impact and cause brain fog, like I said, POTS, the significant fatigue, and patients may be told they have chronic fatigue syndrome, which is a symptom. It's not fully a diagnosis. Right. But with the Bartonella impacting the inner part of the blood vessels and the COVID, you can have kind of a leakiness to the inside of the blood vessel, and that just greatly can impact and cause the microclots that will impact the perfusion, again, the blood and the oxygen getting to the tissues.
Yeah, so I'm sitting here listening to you talk about all of these things about Lyme and long COVID, and I'm thinking, oh my gosh, like I hear these things every day from my long COVID patients. Carrye and I are going to talk about here shortly about an exciting project we're working on together. But as part of that, I've been cross-training with Carrye and learning about Lyme disease. And I'm texting her constantly because I'm having these aha moments. Mm-hmm. Oh my gosh, it's the same. It's the same symptom. Long COVID is making the same symptom as Lyme, which makes this all the more complex. So there's a lot of crossover there for sure. And that's stuff I'm having to learn, every day. I mean, I'm sure you never thought you'd be having to learn this world and I'd have to learn that. But I think we're finding that more and more every day with our patients. It's really hard to tease out when they're having symptoms, could be either or both. But why do you think that patients struggle with having these ongoing symptoms and what's standard treatment? I mean, by the time they make it to you, by the time they make it to us, I mean, they've been through things and they're sick. I mean, what do you think, how describe that struggle to me with patients with their ongoing symptoms and standard treatment? Why do you think that fails them before they get here?
So the human body is very complex. And so when you have a standard protocol and the patient doesn't fit into that algorithm, they're told they're either, there's nothing else we can do or you're crazy, right. Unfortunately. So if you need to dig a little bit deeper. So when I have patients come to me, I don't actually automatically assume they have Lyme disease. So my appointments are marathons. They're a few hours long, and you've had the opportunity to sit in on a long marathon appointment. But I comb through things. I talk through their chronological history, which my people have been sick for decades. And then after that, I talk through a very specific list of questions and do a detailed physical exam. You've also had the opportunity. So just checking different neurological signs and just a thorough exam. And the exam actually gives me a lot of information and data. The patients are actually quite insightful of what's going wrong with them. They just haven't put the puzzle pieces together. So they bring me the puzzle pieces and then I get to put it all together. So I think listening to the patient is really important. And with the Lyme and long COVID crossover, so Lyme, again, is the smartest bacteria. And then we've got COVID, which is a virus. So it has similar downstream impacts, but different root causes, essentially. So some people may say Lyme is, hard to get, easy to treat. We learn doxycycline and ticks, bullseye rash. And there's not a lot of education built into our, programs that we're learning from. But when people say the post-treatment Lyme disease syndrome, it's not really taking into account the persistence, which we can see, and more research is being done about that. But if a patient had truly a post-treatment Lyme disease syndrome, certainly you can have damage if you've had it for a prolonged period of time. And most of my people do have prolonged issues. But if it's responsive to antibiotics, we know that there's still active infection. So that's another thing as well. with the Lyme and long COVID. There's immune dysregulation, inflammation, that kind of all feed in together. But in terms of the not fitting into a box with the standard treatment, I think a big takeaway is you have to dig deeper. And for me, I look at all of those data points and kind of from there move into next steps, whether it be referring over to you guys and then you and I collaborating or whatever that looks like.
Yeah. Yes, I have had the unique opportunity to sit in on your appointments, and I'm blown away. I don't think I've ever been to a provider's office and had that extensive of a history taken on me, much less a physical exam. And it is fascinating that we've moved away from those types of things. You know, I think everybody wants to draw this lab, send this test, do all of these things. And really what you have with you, I mean, in the room with the patient is your brain to listen and like take a history and do that detailed physical exam. I mean, I know I have learned a lot from you, and I've changed the way I've approached patients just because of your comprehensive approach. And you're right. I mean, I feel like sometimes I get stuck, like, am I looking through rose-colored glasses? Everything is long COVID, and I'm sure you feel the same way. Everyone has Lyme. I mean, for us, I guess 100% of those people likely do, but you can't rule out everything else.
Exactly.
And it might be something else, or it might be something else that Lyme or long COVID turned on that they didn't know that they have to deal with. So I think we have to go, you know, that deep, certainly at this point. And a lot of those things, even though they've had a million things checked, there's a lot of things that haven't been, which is also kind of scary. So how do you think listening, actually actively listening to patients, changes the way that you treat Lyme and long COVID and what you do as a clinician?
Yeah, so going into the appointment before I go in for a few hours, I do go in with not assuming it's Lyme. A lot of times I'm one of the last stops kind of on the train. People have gone to different providers, and I go into it with a blank slate. And oftentimes people have been sick a lot longer than they realize. And so, but I do additional labs, like you were saying, that's some things that are really important markers that haven't been checked, or I do imaging if needed. But through all of that data is how I synthesize and do a diagnosis, essentially.
Yeah. And, you know, talking to the patients, and I know sometimes they bring family members with them, which is actually helpful for me too with my long COVID patients, because a lot of them have brain fog. They can't recall details, or did I tell you that, you know?
Right.
So I know a lot of your appointments, family members are coming too to kind of help tell the story, which is important. And sometimes it is a family affair. I mean, I'm treating both of them or all of them.
Right. Yeah, the whole family.
Yeah. And so it is helpful also to get their perspective and to get their input, you know, and listen to what they have to say, because I think that helps tell the story and helps you figure out what you need to do. I mean, I know we all know there are no guidelines per se for chronic Lyme and long COVID. So what does that mean for you as a clinician? I mean, how do you treat beyond the guidelines? I mean, where do you even start? I mean, you know, what guides you, I guess? And if you could kind of maybe tell us a little bit about that.
Yeah. So kind of going back to the gathering information is really important. And treating Lyme is very controversial.
Yes.
Very controversial. So a lot of, in mainstream medicine, the research is outdated. And so there's newer research that's coming out, and it's to some extent being ignored about the persistence of Lyme. It's a very smart bacteria, and it can change forms to evade the immune system and antibiotics. And so there are newer research studies about the persistence of Lyme. So I think us getting new research is really important, but also providers having an open mind to take in and read that research and then synthesize it. But as the patients that come to me usually are, when a provider sees them on their schedule, they're like, oh, shoot, because they just don't know how much more, they can help them.
Right.
And so as those patients are seeing me and getting improvements after being sick for decades, then that helps them be a little bit more open-minded because they can see this person that's been sick for a while is all of a sudden getting better. And, what are you doing to get this patient better?
Right. And I know you and I have talked about this too, but as when you're treating someone outside the box, and they do see other providers, that sometimes creates challenges and barriers, when they're seeing you both. And that's something we just have to navigate through. But as patients get relief of their symptoms, I think it is helpful. And I always tell patients, because they always ask me, what can I do to help? And I always say, share your story.
Yes.
Tell people you're better and tell them how you got better, not to prove people wrong, but just to get more help and to educate people. And I think that is important to empower your patient with that information. And most of them want to, like, who can I tell, And they're my best referral source too.
Exactly.
Let me tell someone else, this is how I got better. And they didn't consider all of that. Is there anything, in terms of like challenge outside mainstream medicine or treating people, outside the guidelines? Are there any challenges in particular that you can think of that you've had to deal with or want to share?
So I think the biggest barrier is testing. So with Lyme disease testing, the sensitivity is really poor. So that's what delays people getting diagnosed. But also this preconceived notion that Lyme disease is only in the Northeast. There's Borrelia, so Lyme disease even over in Europe. So when I was practicing in DC, I had patients from Denmark, Spain, Italy, all over. So I just think providers need to be a little bit more open-minded and understand that this can also be a clinical diagnosis as well. It's a lot more. And you've been in my appointments. There's a lot that goes into it with diagnosing someone in addition to the testing.
Right.
But I think where it's not as clear cut with the testing is what people run into. The barrier of a provider listening to them and treating them. But I'll have patients who come to me and they've had treatment for years and years for Lyme disease with different antibiotics. But no two patients are the same. So I tell people it's like a box of chocolates. So you never know what you're going to get. I haven't had a single patient that's the same. But I hear about the exact same symptoms in different combinations. And so I have a general trajectory for treatment, but it's done specific for that patient. So I have to rearrange it. And I think that's really important in medicine to not cookie cutter treat someone because all of our bodies are so complex, and it just needs more detailed treatment for the person.
Yeah, for sure. You said something that I just want to bring back up because I find it really interesting in treating long COVID is patients always ask me, what test are you going to do to prove that I have this? Or let's wait till the tests come back, before I start treatment. And I think that's probably unique to both Lyme and long COVID because there's not a test, right? There's not a test. There's things we test for that it affects, right? But majority of the time it is based on their symptoms. It is a clinical diagnosis. I think that's hard for sometimes the patients to cling on to, but also especially for the other providers that they see. I mean, what does that mean? What is long COVID? What did you test that showed that they have this? Well, I don't have one. But you talk to people, you gather these patterns just by talking to people. Like you said, they all have the same symptoms and different patterns. But unfortunately, just like Lyme, long COVID, no two patients are the same. So even though we have a general toolbox of medications that we try to use and other things, it doesn't work in everyone. And you have to kind of put the recipe together for everybody. So I think that's what makes it, challenging for other providers to kind of wrap their head around. which is interesting. So I want to shift gears just a little bit. You and I are working on an exciting project. And why don't you tell us a little bit about what that is and how that came to be?
So you and I are doing a hybrid of treating Lyme and long COVID. With Dr. Vaughn, he and I have been talking for years now, and he allowed me to have my little niche of treating Lyme. But I approached him about the crossover, and he's really well aware of the crossover. But I was thinking, how can we best serve our patients? Because I'm cross-trained in long COVID, but I need collaboration so that we can really synergize our treatments together. And I do think that we'll continue to see patterns ourselves and further be able to improve both the Lyme and long COVID treatment together.
Yeah. So, and I can expand upon this a little bit more for you guys. We're, Carrye and I are working together to build a program that are for patients who have both Lyme and long COVID that we've identified. We have a team that treats long COVID. We have Carrye who treats Lyme. And, as we've gone along this team approach, we've realized that a lot of these patients, a lot more than we thought, cross over. Their symptoms are very similar. I mean, they could have had long COVID and now we've reactivated Lyme. They had Lyme, they were stable, now they have long COVID. And so one of the things that I've been doing is cross-training with you, which has been amazing. I've had a lot of aha moments where, oh my gosh, this is not good. Yeah. We have to look at this, and this is going to make our patients worse if we don't address it. So I think the fun thing about this is, these patients get more and more complex, but I think we're already just in the beginning of this, detecting patterns that we're seeing. I know I've learned a lot, just by seeing your patients and learning different patterns and then talking to them jointly, but then also separately and, understanding those patterns, looking back through their medical history and their lab work. It's been really eye-opening. So what do you think, why do you think this is important, that we build programs and structures like this where we collaborate even on two things that are, kind of out there and we don't really have a book for them? Why do you think that's important that we collaborate like that?
So I think it's important and necessary to treat from different directions because patients usually don't just have one thing wrong with them.
Yeah.
And the body is so complex that we've got all these different systems, but they work together. So I think that that's a large component of what the collaboration is built on. And some people ask, well, how do you know if you have Lyme or long COVID? And that's a very difficult thing to tease out.
Don't know.
So I talk with patients for a couple hours and really looking at their chronological history and all of those things I talked about is what guides me and helps me prioritize, hey, do we have positive clotting markers where we need to prioritize the long COVID a little bit more? How can we kind of interwork these, and differentiating a Lyme patient was doing okay, and then they destabilized post-COVID. Maybe they don't truly have long COVID. It just looks like that, and I need to address the Lyme. So it really is challenging, but it takes a few hours, honestly, to tease it out. And then you're able to assess them as well and, look at their labs and kind of help guide you, but we're going to be able to integrate different medications and supplements. And even prior to this treatment or program that you and I are doing, the long COVID team has treated similar to myself in terms of stabilization. So stabilizing a patient is really important prior to going into treatment, whether that's breaking down the spike protein or killing off the Borrelia, because you can have a Herxheimer reaction. So whatever symptom they have at baseline just gets amplified. So we've actually both been doing mast cell stabilizers, and kind of the immune system gets so upregulated or makes a lot more noise from doing that process, but also the inflammation itself from the spike protein and the Borrelia. So it's kind of like same song, different dance.
Yes.
When I first spoke with Dr. Vaughn a few years ago. And so we're already doing some of the stuff going into it, but then it's just kind of expanding out our efforts.
Yeah, I mean, I can certainly attest to the complexity. I remember that first chart I opened, I thought, oh gosh. And it does. It takes you hours to tease out their medical history, but not only that, their treatment plan. And then trying to learn, I guess, those patterns of, they're pulsing, with you treatments. They're stabilizing always, which is the same for us, and how we can kind of mesh those two things together where the patient has relief and feels better from both perspectives without making the other worse.
Yes.
I know you know this, but it's been a really hot topic. At HHS, they just had the long COVID roundtable, which Dr. Vaughn was a part of. And every single sentence, they said something about Lyme.
Yes.
Lyme, chronic Lyme. And so I'm sure you had your pom-poms out. Yay.
Yes.
Because, I think we are hearing more and more about it. And I think people are recognizing, this is also a forgotten, unknown thing.
Yes.
And we're bringing awareness to the table, but they're also already discussing how those two things are kind of lining up and crossing over. So I think we're going to hear more and more about this. I know there's a Lyme roundtable now coming up with HHS, and they even spoke about it that day, which is crazy, but it's great.
Yes.
So I think I'm excited that we're going to get to innovate together and, try to carve a new path and constantly learn, because I think that's what I do every day.
Yes.
As I go through my, training, cross training and stuff, I'm like, oh gosh, who knew? And that is fascinating, because it's not something you talk about in your traditional training. It's something you kind of have to learn along the way. And you really just have to jump into it with your feet and head first. Okay. So tell me a little bit now about some of the new and different areas and other areas that you're exploring kind of outside of Lyme and long COVID that kind of tie into other things we're doing.
So in addition to long COVID, I've been looking a lot more at pelvic venous disease and pelvic venous congestion, as well as venous insufficiency and POTS and mast cell activation. So POTS and mast cell activation have been a thing in my patient population for a while, but post-COVID, it's just been amplified a fair amount. So with POTS, and essentially that comes from the autonomic part of your brain. So kind of like your caveman brain, it regulates the things you don't think about. So your heart rate, blood pressure, temperature regulation, and the autonomic nervous system is supposed to signal to your blood vessels like squeeze harder, loosen up. And so if you have POTS, which can be inflammation from whether it's Lyme, long COVID, or other things, what can happen is from a neurological standpoint, your blood vessels are not squeezing. And so you're not getting that blood back up to your brain, which again can cause some of that brain fog, fatigue. So with about 2 years ago, I started learning about the pelvic venous disease from Dr. Vaughn. This is when I was working up in DC, and I started seeing it in my patients as well. And I was like, oh my goodness. But again, there's that overlap. And so with Lyme, you're in such a inflamed state that it can cause laxity to the ligaments and tendons. So in our Lyme population, we've seen cranial cervical instability and different like CCSVI of the head and neck vasculature. And so I started doing imaging just like Dr. Vaughn does and seeing this compression. So I have also been collaborating with Dr. Brooke Spencer out of Denver, Colorado, and she specializes in that. And then also Dr. Alexis Cutchins, who is a cardiologist and now works in New York City. And so that's something I'm really excited about. I think that that's going to be a big puzzle piece. And from a POTS standpoint, again, part of that is neurological, but I am starting to take more into account the vascular aspect of it. So we've got a structural issue in addition to a neurological issue. And COVID is what has really impacted the blood vessels. And so that's just amplified that. And then from a mast cell standpoint, when you have such immune chaos from this very complex bacteria, you can have upregulation of your immune system. It's making more noise. So that's going to create more mast cells. And then mast cells are going to suppress your immune system and has potential to make you lose traction with Lyme disease. So it all fits in together. And it's kind of, once you see stuff, you can't unsee it, unfortunately. I mean, fortunately and unfortunately.
Right.
So that's a big area of interest that I'm having right now and collaborating with the whole team. But it's kind of like a little triangle, square box that we're all in there together.
Yes. Well, yeah, I feel like, I mean, every day I'm like, what next do I need to check? The venous disease is interesting because I know Dr. Vaughn has been looking at that for a couple of years. And now it's really on the forefront of when I'm talking to patients. I mean, I can remember even the evolution of like our team approach. If patients hit a plateau and they weren't getting any better and we're looking for something else. And now right out the gate, I'm already thinking, we need to scan you. You may have this problem. And, you know, certainly having collaborations with Dr. Spencer and Dr. Cutchins, I think that is so important. And both of them have been so helpful to our team. But not only that, they accept what the other teammate is doing.
Exactly.
And that, I think, is a huge piece of it. Is an understanding and appreciation of how all those puzzle pieces do fit together. And if we ignore one, we can't put the puzzle together at all.
Exactly.
So I think that has been, you know, really awesome, and, you know, getting that team collaboration across the country. So that's exciting. And so there's often, just switching gears a little bit, there's often stigma and skepticism around Lyme disease, treating chronic Lyme and, you know, post-viral illness and long COVID. How we talked a little bit about HHS, and we think awareness, you know, is more, we're talking about it. Maybe it's not so taboo. We can get the words out. How do you think that it's changing, or is it changing? And are you optimistic at all?
Yeah. So I think that just like Dr. Vaughn has said in the past, this has been opening Pandora's box to some of these vague symptoms and diagnoses. And so many providers are more open-minded. And so that is kind of helping open up the door. And also, I feel like many providers are looking more at research versus doing their standard day of seeing patients. So I think that's encouraging of there's just more awareness, and the word Lyme is being said more often in long COVID, and patients are hearing about it and wondering, hey, I've had these symptoms for years. And especially in my Lyme patients, a lot of them end up getting diagnosed because, I heard from a friend, a family member, a coworker about Lyme, and my symptoms look a lot similar to theirs, and so maybe I should get tested for Lyme. And that's actually my story as well. So I went to Mayo Clinic, and again, I went all over, and ultimately how I got the not idea, but kind of I heard from a friend that had similar symptoms about her having Lyme disease, which prompted me to go and request Lyme disease testing. So I think the stigma with that of it's more open in the community and on people's mind, essentially.
Yeah. And, you know, you've talked about kind of how the Southeast, we don't have Lyme disease. It's not here because the ticks aren't here because they don't cross state lines.
Yeah. But vets will tell you that Lyme is here.
Yeah.
So it's funny.
Do you think, because you have colleagues still in DC who do the same thing, do you see a difference maybe there and versus here about awareness and stigma still, or are they similar? Or?
There still is. It depends on the provider. So some are, you know, have you been to Connecticut or upstate New York? But again, there's migration of animals, so that they don't just stop at the border of Connecticut or upstate New York. So I think across the country there's still a stigma, but even since 10 years ago, I feel like we're making steps in the right direction. With patients getting diagnosed.
So do you feel like that's different down in the Southeast versus other places of the country? Are we still behind? Are we caught up?
Yeah.
Where are we?
Yeah, we're still behind.
Okay, yeah, we're still behind.
In true Alabama fashion, we're still behind.
Okay.
So it's really not on people's mind down here. And interestingly enough, up in DC, when I was there for a few years, I treated some alpha-gal, but down here it has been absolutely just in an average week, I see a few patients with alpha-gal, whereas I didn't see as much. So that's interesting in the Southeast, an added component. And alpha-gal is an allergy that comes from a tick bite. And what it does is people are not able to have mammalian products, so they can't eat red meat.
Yeah.
And so that's a big player into stuff, and you don't realize how many like mammalian products are in our day-to-day lives. So I think alpha-gal is more recognized down here potentially. And that testing is pretty solid, which is nice to have one thing that you can test for and just objectively. The same with the iliac vein compression. You can look at a scan and see it.
Right.
Whereas in our Lyme and long COVID world, it's a little bit more vague.
Yeah. Yeah, there's definitely some uphill battle in terms of diagnostic. And again, that objective, and not for us, because we know these can be clinical diagnoses, but when they're going to other providers, someone needs to see something.
Yeah.
And sometimes the patients, want that validation after they've had so much, testing for other things that are not there. Everything is normal. Maybe they're crazy. They've been told. But yeah, that's a piece of the challenge. But it's good to hear that I think we're at least talking about it more. I mean, I feel the same way about long COVID. As years go on, people at least are starting to recognize that we're having conversations, on the Hill at least. I mean, that's amazing because we definitely weren't there a couple of years ago. And now they're talking about Lyme in the same meeting. So, I mean, that is definitely an exciting move in the right direction, I think. How do you think that all this awareness is going to play into our clinical practice? I mean, as we're trying to see all these patients, I mean, what do you think is going to happen?
Yeah, I think it's going to end up kind of exploding, busting at the seams. So I think that the Lyme and long COVID picture together is something that's a little bit more novel. There's some providers who are trying to treat both, but I think our collaboration is going to be unique in that. So I'm really excited for these patients that they have somewhere to go to have a little bit of a collaboration, a tag team, basically. So I think that that'll be really great.
Yeah, it's definitely exciting. But I too am like, this is gonna explode. I mean, and as patients hear, I think, oh gosh, I'm having those symptoms, and they're checking all those boxes. And it's interesting how they find their way to us. I mean, I know patients come to see you from all over the country, which is the same for me and our whole entire team. But they ultimately find their way. And then they get answers, and they keep coming back and then telling other people. And that's really what it's all about, is trying to empower people to get the treatment that they need. But sometimes that's a long road, that they have to advocate for themselves. And they've been through so much gaslighting, which I know you understand.
Yeah.
So what gives you, I guess, the most hope right now in terms of Lyme and just chronic disease in general, or any of those mystery diagnoses, long COVID, Lyme, that we maybe haven't talked about? What gives you the most hope right now that we might be, forging forward?
I think attention, like you were saying, from an HHS standpoint and from a policy government standpoint, there is a lot more. It's on the forefront, basically. And then I have other providers who have referred over to me because they're like, I have this patient with all of this stuff and I can't quite figure it out. So here, let me throw you this patient and like you sort it out. So I'm excited about just the newer research. There's a lot more emphasis on research that's emerging because COVID is kind of a newer thing, and Lyme has been around for a long time, and so I think it's prompting some new research on Lyme disease as well.
Yeah, that's great. I mean, I think the more attention we can get, which is also what we're here to do on this podcast, is to talk about things that people haven't talked about, tell the truth, try to get it, out there where patients who are listening and people and providers who may hear this say, gosh, me too, or my patients too, or how can we collaborate together? What is a message that you would like to share for patients who are still seeking answers? They don't know. Maybe they've been told nothing's wrong. They've been to Mayo and all the places, Johns Hopkins, wherever they've been. What would you like to say to them if they're still seeking answers?
Well, I have been there,
Yeah.
and it's a very discouraging place to be.
Yeah.
And at some point, you kind of just throw in the towel, and you're like, instead of being gaslit, I'd rather just deal with my symptoms because nobody has answers anyway. But just continuing to advocate for yourself and look for a provider who is open-minded. And sometimes that can just be a trail of, I have patients who have seen over 50 specialists. And so just continuing to seek that care and not throwing your hands up and living with the symptoms.
Yeah, I think that is really important. And I mean, I think we see that in all the patients that we treat, both separately and together, is that, I mean, they have been through so much and been told so many times, including myself, nothing's wrong with you. Go see psych. And yes, I say to them, yes, go find someone who will listen. There aren't that many.
Right.
But there are people, and I'm thankful, you are one of those people too. And, certainly we're in a place where we can practice freely and investigate the things we need to help make people better. So yes, advocating and not giving up and finding the people. But it's a long road. And you do get tired, and I get tired of gaslighting too. And then I'm like, well, I'm not even going to go anymore because what are they going to say? I mean, what are they going to do?
Exactly.
But I think, having that hope that there is someone who will listen eventually. What does healing mean to you? I mean, we've talked about this a lot with several people, and people ask me every day, you're healed, right? My patients, you're healed, you're better. And that's a hard thing to answer. I mean, so what do you say to patients, and what does healing mean to you that you'd like to share?
So since I went so long without being diagnosed, I will have residual symptoms the rest of my life. And that's okay. I kind of tell patients I am functional, and for me, that's good. But there are a lot of patients who come and they do get completely better. But there's some who they've been sick for decades, or it's so deep-seated into their central nervous system where they'll have residual symptoms. So healing to me, it does look like an improvement in your symptoms, but also just more hopeful. You finally got an answer. And sometimes patients, when they come to me, just hearing in and of itself, I know some things that could be wrong with you,
right?
And I know some things that can make you feel better. That in and of itself has a lot of power to it.
Yeah, absolutely. I mean, I think you're right. I mean, I've talked to several patients and even myself where healing, I mean, yes, I'm out of bed. I can breathe. I'm functioning, but I don't know what this has done to my body long term, and I don't know what we're dealing with. I mean, in many ways, I feel like long COVID is a chronic disease, and we won't know for years and for decades really what it's done to our bodies, what that impact downstream is going to be. So, I'm cautious, both in giving hope, which is what we want to do, but, we have to be realistic. Like, I don't know. I mean,
exactly.
We can get you to a functioning baseline to where you were. I don't know what the normal is, or this is your new normal maybe. But I think having that conversation with patients, which I've heard you do with your own patients and with our patients collectively, is just being realistic. Like, there are things we can do to make you feel better. But how long? It's not like do you get to check out and never see me again? I mean, ring the bell.
Right.
That would be great.
Yes, that would be nice.
But I don't know what's realistic, and I just try to walk, in truth beside them and say, we're going to, try things. And if it doesn't work, we'll try something else. And, there are definitely things we've done that we know help people get better. But I think healing looks different for everybody for sure.
Yeah.
And you definitely have that, I'm sure, in your practice. Okay, well, Carrye, it has been really exciting. First, working with you on a daily basis, I've learned a tremendous amount. I'm really excited about the opportunity to continue to learn with you and to see these patients. And I'm hoping that it leads to a whole new path forward in getting these people better. And I hope it definitely helps, with awareness and getting these people where they need to be. But I'm super grateful that you came down to talk to us today and share with us, and that I get to be a part of your team every day. So thank you for your time, and thank you for all the time you're going to give me in the future for all my questions.
Well, I am looking forward to continuing to work with the Long COVID team, because I learned something in your world all the time. So I'm excited about the collaboration and that you have me on the show.
Yeah.
Thank you so much.
Yeah, thank you. Well, thank you for listening in on this episode with one of our expert team members, Carrye Hodges, who is all things Lyme disease. And now we have a new program that is going to incorporate both Lyme and Long COVID. We're very excited to be working together on that and to have her in today to tell us all about that. So we hope we gave you some knowledge that you can share with others, maybe yourself if this resonates with you, where we can lead people to getting the truth and hopefully getting better. So thank you for tuning in for this episode of The Long Haul with Summer.